everyone, I'm Katie and I'm one of the hearing care assistants here at Audiology Associates.
My name's Rhys, I'm one of the audiologists here at Audiology Associates. Your patient?
It is my first one. So this one I believe we ended up getting a like, deep plug out of it really.
Yeah.
I thought, you know, just by the first initial bit it was just going to be a nice little bit of well, skin really, but it looked quite dry, but I thought I was going to struggle to get it out, to be honest, but I didn't.
Sometimes you never know with these skin ones. Do.
Yeah.
Sometimes they're rock solid, sometimes they're nice and soft. That's all right. That's not too bad.
That's why I don't initially put the oil in. Because I'm like, well, try it first. I'll test the waters, see what the consistency of is like, really.
Because sometimes it can look, as you get it sometimes when especially patients be using oil, it can look really soft because oil's already in it, but it can be absolutely rock solid. But you don't always need to use it for skin.
No. Obviously I put the fine end on because it was a bit deep down into that ear canal there. But no, nice easy one. Same both sides really, but this one looks a little bit different. I think this is the one where we had the big plug out of it.
Yeah.
But as you can see, that it's been building up in there for a while because the patient did say, like, after it was done, it was still a bit tender. But also, as you could see at the end of the visual, then it was a bit red. But
you get that when you kind of strip in these old dead layers of skin off. You get this fresher layer of skin underneath them, which is it's the kind of normal canal wall skin. Yeah. And it can look a little bit red and irritated after just because you've stripped all away, and it's all the nice kind of peachy, kind of pinky skin.
Yeah. But I think this one, like, before we come in, he was saying, like, his sound was very intermittent. Like, sometimes he could hear, but sometimes he couldn't. Okay. But I think it's because like, obviously the canal would shut down over it. Yeah. But then he says first thing in the morning, couldn't hear nothing throughout the day. The canal was, like, where he's been talking, was giving him a bit of volume. Yeah. So he wasn't sure if there was any wax in it to begin with when he first come in.
That's a heck of a plug. And you can see that thicker, old kind of white. It's really spongy sort of skin that wraps around it, isn't it?
And it's so tough.
Yeah, they're not easy ones to remove. They're not easy. No. Sometimes you'll get like a nice squishy bit in the middle, and then you'll get this kind of wrapping of skin around, which looks like what's going on there.
Yeah, we've had some of them, like we try and go in for the middle, and you just like push the middle in, and the other bit just squeeze out.
Yeah, you got it. Yeah, it's not easy.
No, but I maybe probably should have put a bit of oil in by now, but I'm just peeling away nicely, just making my way around like a bit clockwork really, just to try and peel it all down. But it was very, very tough.
That's what me and Taylor do sometimes. We'll work our way around the edge just to try and work out, what's the best place to approach it on. Because you'll kind of probe the edges of it.
Just where you get the most movement, really, isn't it?
Yeah. Well, there you are. There's your oil.
There you are. There's like drowned.
There's a lot of oil in there, isn't there? Nothing squeaking coming out of there.
I thought, let's just get it all in. So it's like as everybody knows, it makes such a difference.
Yeah, it does. It does. Especially with skin as well, I find it does make a lot. The problem you have with these types is because the centre is so squishy, normally you want a really good grip on that centre to kind of wiggle the skin off the canal walls. But in this case, it's so squishy in the middle, you're not going to get that grip. And it is a case of trying to peel it, but then you need the middle free to peel it into. Yeah,
so you can see it's just squishing all in. But I thought, I couldn't really find where the best place was to get it, except for this bottom right, where I'm going there.
Yeah, it makes sense.
It's the only bit that seems to be peeling, like, off, but...
Yeah, that top section, you can see where you're kind of trying to draw it along. But it's not peeling away particularly
just,
well.
Like, obviously, like, still learning. It's getting the position to get the probe up to that point at the top. But it's just learning.
Sometimes if you can't get the angle with your wrist, sometimes what I'll do is I'll change the patient angle. Yeah,
like his head was slightly tilted. Yeah. But when I was going in, I remember he kept like straightening it up. And every time I'd like come out to like, you know, clean the camera or something, he kept popping his head back up. So I don't know whether it was uncomfortable for him or something being in that position.
Sometimes, but if you're kind of there for a long time.
Yeah.
Like I will get somewhere, you'll go to put it in here, you'll get, so the patient will be looking sort of side on to you, and they turn their head away as you go around, so you kind of go around with them.
I know. I had a patient earlier and I was trying to get the wax out, but he kept chewing his chewing gum. And I was like,
and so your canal's doing this constantly.
Moving massively. I was like, please stop chewing that. I didn't want to sound rude or anything, but I was like,
it's because you're bridging as well, so you're bridging around the TMJ, so when the jaw's moving, you kind of, your fingers go up and down like that. Yeah, it does happen.
I know, it was a bit difficult, but I put some more oil in because this bit just was not moving. So drown it up again.
This is that downside of oil, isn't it? And you can see in this one now, sometimes you'll think, right, yeah, that looks great, oil's all gone, I'll just pop the suction tube on, and then you'll pick up, the suction will just cause a little bit of oil to leap up off the canal wall and just blur the camera again.
And I know it hasn't got a lot of hairs, but even touching a tiny bit of that hair, because the camera's so small, it's just like smudge.
Yeah.
But trying to clear it out before I was working my way in then.
Do you use a cotton bud to clear it sometimes?
I do sometimes.
Yeah.
But then I do feel bad things. I tell the patients not to use them at all. And then I'm there like just sticking a cotton bud in. So.
I always say, you shouldn't really be doing this, but I'm just clearing the oil, I'm not going in. So they know it's not something you should be using clearing the ears, but just to get that little bit off.
Yeah, then I've had some patients be like, oh, so can I just use it on the outside? I'm like, no.
No, we're only taking the oil away, we're not doing anything else with it.
So no, I don't tend to, but I knew I had to get that gap.
Yeah, you can
try and peel
back to see it now, and that's always good sometimes, because like we're all guilty of it. You're working so camera's so close, and you're working really close to the plug that sometimes we forget to just take that step back.
You can draw back a little bit,
and just to get the lay of the land, and sometimes you will find a little lip like that you can exploit.
Yeah, I always tend to go a lot closer with the camera when I get deeper in.
Yeah.
To make sure that I'm only at the limit of where I can.
Exactly. Yeah, exactly. But that's deep though.
I know. You can see that the colour changing now, like a dark is getting.
Yeah.
So that's been brewing for a while in it, I think.
Yeah, and you are like right down on top of the drum there, aren't you?
Yeah, so I've obviously been very, very careful here, but as soon as I seen it start to peel away, I was like, I hope it all comes off in one piece.
Yeah, that'll be nice, the whole thing starts to move. Sometimes you're really lucky and they will, and you'll get that big peel.
Yeah, but luckily he had quite big canals, so I was able to do a lot of wiggling.
Yeah, that does make a difference.
Massive difference. But it was getting there, it's coming. You can see all the oil sliding all down in there now, so...
It really gets behind it, gets underneath everything.
The drowning of oil works very well.
Oh, massive, yeah. Me and Taylor were having this conversation, we were doing some voiceovers this morning, and I was saying, with those deeper sections, really getting that oil in there makes a huge difference.
Yeah, it all come off in one.
Brilliant. Oh, nice.
Very
lovely.
Red, but
that's quite normal, though, for those types of ear canals.
Yeah. What's on to you?
Oh, it's me now. Yeah, sorry, this is my one. So yeah, so you can see a very, very dark colour to this wax. Old wax. This one, not the biggest of ear canal entrances to get through. So very soft at the base here. Yeah,
I always find with the smaller canals, it's like where the left hand side comes in.
Yeah.
It's always stuck there.
Yeah.
And you're always trying to pull it open. I just say to people, I wish I had 3 hands sometimes.
Oh, it would make it would make life a lot easier. Should develop something you clip on the back and just pulls the ear back over your hand. Like a headband or something.
Like a robotic hand, it'd be brilliant.
Like a helper hand. Kind of thing. Probably don't remember Inspector Gadget. Do you remember Inspector Gadget?
I do, actually.
Oh, like a go-go gadget arm that comes at the top and kind of pulls the ear up there.
Get on Amazon, we'll have a look.
Yeah. Let's get some back, give us some pincers to come out the side. But it's coming away well. You just get this issue like we've got here. You're trying to draw this down the canal, and it's such a narrow entrance. You've got to make this bend right, the first bend. You've got to pull him around that first bend. And it's so difficult to do if the wax is not completely solid or if it's just a bit too big.
Yeah.
And that's what we're kind of running into here now.
It is a tricky bit when it gets jammed like that, isn't it?
Yeah, it's not an easy one to do when it gets caught in the corner.
No, they try and open it up wider then with the left hand.
Yeah.
If you're in right hander, yeah.
Because normally you'd be pushing that section open with the endoscope.
Yeah.
And then when you're out this far out, your endoscope off that bit of skin, so it just collapses down around it. But this is the Rhys curetting this one now, so I'm just going in just to use a manual tool, because sometimes that's just easier, because you can use the side of the manual tool to push them across. So just move position now so you can see it starting to come out a little bit easier.
It's lucky you got that gap there to be able to do that.
Yeah, yeah.
It was a fair old bit, isn't it?
It was a good sized lump, in fairness. Yeah, it was nice and dark in colour as well, so an old one. But it managed to get it out. But sometimes you do struggle a bit with those. Let's have a look at the other side. This looks like a deeper section of wax here. Not quite so easy to get out.
So, no, like with the first look of that now, with it looks wet, doesn't it? So I might have gone for irrigation here. Would have that been successful, do you think?
Probably, I would have thought. It all depends on, because you can see, as we were looking just past it, we could see that kind of much darker section further in.
Yeah.
But you can see the top of the eardrum. So irrigation works really well if it's either a very, very wet and mushy wax, or if you've got that little bit of a gap at the top, so the water then can go past that and flush down and forwards. So it will tend to bring it out then as well.
Flush it out, yeah. I suppose if there's no gap, there's nowhere for water to go, is there?
Yeah, if it was like a solid plug, what you'd find if you used irrigation, it kind of would just wash the front of the plug. Yeah. So it'll soften that front section, but you wouldn't have got that back bit.
No, and that's where the water starts squirting out.
Yeah, that's what it all comes when you're flooding back out. I had a young boy in yesterday, actually, I had to do some irrigation with, and honestly, I put it in, and it was as soon as it came on, the water was just almost black coming out straight away. Yeah, it was loads of it came away. And then probably I'd say within 5 seconds, our water was running clear. It would all just come out in the first couple of seconds. Yeah, it was brilliant. 3/4 of an inch.
2 centimetres? No, yeah.
Yeah, that's it. So you read it, so thanks guys for watching our video again today. If you do enjoy the videos, don't forget you can always like, heart, share, follow and subscribe for us. If you really enjoy the videos, you can also consider becoming members of the channel. That way then you get to see even more videos every single week. But until next time, take care of yourselves.
Take care of your ears.
And take care of one another. And I think it's you and Taylor next one.
I think it is, yeah.
So we'll see you then.
Bye, everybody. Bye, guys.